Hello. Well, this is an interesting hello. I'm going to take this off so you can actually hear what I'm saying. Here's my lovely face shield. It says face shield, just in case you haven't known. And this does look like something from Star Wars. Again, I'm not sure if you can hear me, but I'm going to take it off. Well, this is what I've spent all day in today in the operating theatre, treating patients who might be COVID positive, most likely not, but the precautions that we're having to take while we're operating on patients within the NHS are significant. As well as this, I had a full length gown on, I had gloves on, the theatre was roasting, and I come home every night absolutely parched. Those of you who perhaps don't know my background, I'm a consultant anaesthetist. I've also worked as a consultant in intensive care. First came to Lancashire 20 years ago and started work at Royal Preston. And I only stopped working regularly at Royal Preston 5 years ago when we set the clinics up. But obviously since the clinic has been closed, I've gone back and done more work in the operating theatre with NHS patients, and it's been great. I've really enjoyed it, but I've missed the clinics. Unfortunately, in about 3 weeks' time, we're going to reopen the doors, week beginning the 6th of July. We've had an incredible response. The slots from me are pretty much booked out the whole of July now. So please, if you want to book in to see me or any of my team, email us on info@rejuvemed.co.uk or go to our website, and you can book online for most things. If it's Botox, fillers of some sort, or it's hydrofacial, we're taking bookings for most treatments. If you don't see it, then email us. But we're incredibly excited. It's going to be great to be back in the clinics. At Clitheroe, as you know, we also offer some additional medical treatments, treatment of varicose veins, women's health, bioidentical HRT. We do weight loss management as well, and in our smaller Chorley clinic, other treatments such as body sculpting. This is what you need after lockdown. Everybody has put on weight, so we can do great things with 3D lipos, amazing new medical grade Ultimate Pro system in terms of busting that fat, sculpting that body, getting rid of the wings that are hanging everywhere. So lots of exciting things that we can do, but it's all going to be a bit different, and that's really, I kind of guess why. I showed you a little bit of this. This isn't going to be quite as extreme as what we need to be doing within clinic for most of our treatments, but the experience, as I say, is going to be a little bit different. We've got to keep you safe. You're getting used to this, whether or not. It was a 2-hour queue for you outside Primark the other day. What's happening there? I don't understand that. But we've got to make sure you're safe. So we've got to maintain social distancing as much as possible, protect you, protect our staff. So it means minimizing contact and keeping things clean. So if you have an appointment booked already, fantastic. We will be contacting you a day or two beforehand to collect full payment for that treatment, to reduce the amount of contact that you need to have with our reception staff, with card machines, etc. These will all be cleaned down if people use them, but we want to try and reduce interaction as much as possible. When you arrive, and we ask you to arrive on time, not 25 minutes early as some people do. We did make lovely coffee. I'm afraid the coffee machines will be in the cupboard for the moment, as will the glossy magazines, Lancashire Life and Live, fantastic as they are. So we ask you to arrive on time. You'll be met by one of our lovely floor-standing hand sanitizer machines, which will automatically dispense some lovely hand sanitizer for you to clean your hands, and you'll be given a face mask to put on, little loops behind the ears while you wait. And that's not going to be for long, because we aim to minimize waiting time in our reception areas. Unfortunately, unless there's a medical need, you'll find our toilets are closed, again, to minimize risk of infection and people being in the same place, touching the same stuff. We'll obviously be doing lots of cleaning of surfaces between patients, but we aim to get you in to see me or one of my team pretty much as soon as you arrive for your appointment. I'll be wearing a mask. I hate talking through masks. It's not easy, but we'll be wearing masks, both yourself as a patient and me as a doctor. And then once we have to get on into your treatment, there'll be PPE. We're all used to hearing about PPE. Yes, again, not as dramatic as this. You can't hear me speak through this. I've been shouting all day, so as the surgeons could hear me, and people in theatre. But have a face mask on, I'll have an apron on, I'll have gloves on, and we will have to take your mask off if we're working on your lower face. But there'll be lots of hand washing and making sure that everything is kept as aseptic and low risk as possible. Once treatments are done, we'll ask you to deposit your face mask in a safe place. Feel free to take it back out and wear it in the street if you wish. It's yours to keep, no charge. But you can use it for the rest of the day. We then clean the room thoroughly, make sure everything's wiped down. So we're having longer appointment times. So we're seeing fewer patients within each clinic session that I do. So it does mean that it's been a little bit difficult to get booked in, and I understand, we had so many people getting in touch when we first announced we booked, and thank you for that support. It really does mean a lot. We're bringing the same kind of processes that I have learned and used as a doctor in hospital practice into the clinics that we use, and it's very different from what you'll find in beauty salons and hairdressers. This is a whole different level that we're offering. These are medical treatments in general, and we need to make sure they're done properly. That's why we're here to work with you. So it's only 2.5, 3 weeks away. We've had an amazing time sending you out ZO skin health products while we've been closed. Lots of video consultations, and again, we've been seeing patients old and new for video consultations, and this is something that is going to extend past lockdown, whether it's in the NHS, whether it's for other healthcare treatments, whether it's within Rejuvamed. Lots of telemedicine. You don't always have to come into the clinic to speak to a doctor. I'm finding that by chatting with somebody at home, nice quality camera, we can actually talk and see and discuss treatment, and only then when you actually have a treatment, I need to get hands-on, do you actually need to come into clinic? And again, that reduces contact time and improves safety all around. But for skincare, we've been selling a lot of it online, and people are finding it's great. New patients are raving about it, they're coming back for more. We've been discounting ZO by 10% for all purchases over £150 when we've been closed, so that clock is ticking. So kind of one of the messages for today is, if you need to stock up, then stock up soon. Drop us an email, send us a message on Facebook, we'll get in touch with you, and we'll make sure that we get your orders sorted before the 4th of July. The deadline is going to be the 4th of July for our 10% discount. But we thought you need a little treat beforehand. And this is something that we've not stocked before. This is ZO's Body Emulsion. Now, I've worked with ZO for a while, and to be quite honest, I hadn't heard about it. It was only when I was on a teaching forum with some of my colleagues a couple of weeks ago that they all started raving about this body emulsion and how fantastic it was. And I thought, what's body emulsion? Yeah, me bad. But we brought it into clinic. We've got a supply in today. I'm told that it's great for general skin. You're going to get this rough skin on the back of your arms, keratosis pilae. Fantastic for smoothing out the skin. Great on the legs after shaving. Not something I can personally talk about, but great on the legs after shaving. And it just makes the body skin feel fantastic in the same way that the facial products work on skin. So this retails normally at £78. So I thought, right, let's do a half price offer. Our last half price offer before we reopen the clinics. So £79, half of that was wrong in the last video, my maths let me down. £39 for 240 mils of body emulsion. Use once a day. It's got retinol in it, it's got other fantastic products in that have big long names and I can't remember. But it's amazing, and the other team members who are ZO specialists were raving about it on our professional group. So this wasn't just big it up for the sake of it. Their patients love it. So my apologies that I've not actually brought it to you before now. But drop us an email. Anyone buying products to the value of £175 or more can buy this as an addition for £39. You know, it's a no-brainer. Get some. You need it. This is going to make your life much, much better. So I think that's all. I need to go and rehydrate after a day in this. It really does wear you down. You feel absolutely knackered by the end of the day. My colleagues working in intensive care, I've not been in intensive care for some time, still doing a fantastic job and wearing this for hours and hours on end without coffee breaks, without tea breaks, doing an incredible job. But my colleagues in theatre, again for our theatre work, hats off to them, all working incredibly hard. But it's going to be nice to get back and make people beautiful again, more beautiful again. Really looking forward to it. Hope to get maybe one video more in beforehand, showing you the changes that we've actually made to the clinics, giving you a bit of a walk around, showing how we're going to make it safe for you. So don't be scared about coming into clinic if you need to come in. It's going to be as safe as we can make it. Don't put up with these wrinkles. We can help. So great to talk to you. Those of you who've not booked, please do. info@rejuvemed.co.uk or go to our website, rejuvemed.co.uk, and find the book online button. And I'll see you soon. Okay, bye-bye.